welcome back to the Ask Dr. Renee show here at blackdoctor.org. I am so excited for tonight's conversation. In case you didn't know, February is Heart Health Month. So besides love, there's also the hearts that we need to beat inside of our chest, right? So today we have two special guests that I'm so excited to have this conversation with because it's going to give us a lot of great information. So what I need you guys to do is please share the broadcast. If you're watching on Facebook, if you're watching on YouTube, share the broadcast. I don't care where you're watching from. Make sure you share the broadcast so that everyone who needs to see this sees this, because guess what? The one thing we all do have in common is we all have hearts. So let's make sure that everyone gets this information, right? And unfortunately, in the Black community, hypertension, which is high blood pressure, is one of our number one killers, and heart attacks as well, and strokes. And all three of those have to do with the heart. So you really, really, really want to make sure you get this information. Today, though, we are even more blessed. We have a pediatric cardiologist. So we're going to talk about your children's hearts as well, because in case you didn't know, children are getting these adult kind of diseases that we think we find in adults, they're getting them too. So we want to make sure that we talk about the kids as well so that we can nip it in the bud, and then hopefully they don't end up with the issues that that a lot of adults in our community are battling with. So share the broadcast. If you have questions, type them in the chat, and I will do my best to go through them and try and make sure they get addressed. And don't forget to let us know where you're watching from. So I'm so excited. So we have two guests. One is, of course, seeing patients. So when she is finished, she will hop on. But for right now, we have my wonderful friend here, Dr. Michelle Wallace, who is a pediatric cardiologist. Good evening, Michelle.
Good evening, Dr. Renee. How are you?
I am fabulous. Thank you so much for joining us. So I want to start out with, what is the biggest difference besides size between the adult hearts and the children's hearts?
Well, for the most part, they're the same. They really are just different in size. But in terms of what I follow in my practice from day to day, it varies from the adults in that I do manage a lot of patients that have what we call congenital heart disease. So heart problems that they are born with. Either they have abnormal holes in their heart, abnormal valves, abnormal blood vessels, which is a little different from what the typical adult cardiologist manages, which tends to be a little bit more of acquired heart problems. Although I will say that more adult cardiologists are taking care of patients with congenital heart disease because our patients are living longer and longer now. But we manage primarily those that are born with abnormal hearts or have abnormal heart rhythms. But lately we have been managing more and more of patients that have high cholesterol and high blood pressure as well. So I think that speaks a lot to what we are really focused on during the month of February, although I do not want to forget that we did celebrate Congenital Heart Week this month from February 7th through February 14th. But a lot of what we're really focused on during this month really has to deal with acquired problems. So thinking about our cholesterol, thinking about our diabetes, thinking about smoking and obesity and the effects that all of these factors have on the heart and increasing our risk for a heart attack and stroke, as you mentioned.
So children nowadays, unfortunately, let's start with the congenital. Talk about, and I personally know somebody who had this. Talk about, you mentioned hole in the heart. Explain that, because a lot of parents, they get these diagnoses for their kids and they're like, oh my God, what do I do? I'm sure I'm sure you can talk about the diagnoses that come before the baby even comes out of the mother.
Yeah, so that's actually an area where I've been blessed to be involved in the fetal heart program through my training and in my current position. So we are able to diagnose now prenatally as young as 18 to 20 weeks. We're able to look at the tiny fetal hearts and identify abnormal holes between the top or bottom chambers of the heart. So when there's a hole between the bottom chambers, we call that a ventricular septal defect. defect or a VSD. If there's a hole between the top chambers, we call that an atrial septal defect or an ASD. We're able to identify malformed valves. We're able to identify blood vessels that come off of the wrong area of the heart. So maybe the blood vessel that goes out to the lungs comes off instead of on the right side, it comes off on the left side of the heart or vice versa. And we're able to actually make these diagnoses much earlier and then come up with a plan for how we want to manage these babies. So I think that's played a big role really in our ability to have longer survival for our patients because we know what they're dealing with. We have a good sense of what they need right when they get out of the womb. And if they need high level care, like in the NICU, we're able to provide that and get them transferred to the appropriate facility for surgeries if needed, or even come to, in Atlanta, it's a little bit different because we don't have, our children's hospital is not a birthing hospital. So we can transfer our patients over and have surgery at our hospital system if they're at outlying hospitals, and we're able to come to them and talk to the parents in the hospital about what their babies have, even though the child may have to have all of their care ultimately at the children's medical center. So this is a blessing to be able to be involved in that program and to actually see survivorship increase amongst patients with congenital heart disease, because there was a period in time where if you had a diagnosis, particularly if it was a severe diagnosis, that might have been one that we would provide comfort care and you may not survive. But now we're having more and more survival for patients with the most critical forms of congenital heart disease because we're able to do procedures much earlier. Our procedures we're constantly perfecting our procedures, but they certainly are better than some of the earlier surgeries that were being done. And so we're seeing patients live longer and longer, and that's really led to the development of the field of adult congenital heart programs, so that now these patients that used to die in childhood are now making it into their 30s and 40s and thriving. And so we now need a group of adult cardiologists that will see them beyond 21 years of age and have an understanding of their anatomy and their special needs, in addition to the acquired things that they can develop just from their lifestyles. So.
Awesome. That is wonderful. I love science because of the fact that we can improve things and make sure people live longer and healthier lives. So we know that right now in this country specifically, we have a really bad obesity problem. And needless to say, obesity leads to a whole lot of things. But heart problems is one of them. So can you address how are we getting these children with these awful problems that I would call big people problems?
Yeah. So what we've really noticed, particularly since the 90s, is that the obesity epidemic is getting worse in children. And I definitely feel that during the pandemic, we've actually seen a spike in that as well. And what we know is that when you are obese, that you're at higher risk for having, for instance, type 2 diabetes. You're at higher risk for having high blood pressure, and you're at higher risk for having high cholesterol. And so we're seeing these numbers go up in children as well as we're seeing the obesity epidemic increase. And particularly when we look at cohorts of patients who have the highest prevalence of obesity, patients of color are at particular risk. So in particular, patients of Hispanic or Latino origin, or those of Black African American origin, like we're talking about prevalence of about like 22 to 24%. And then when we talk about high cholesterol, in general, there's like about a 20% prevalence of high cholesterol in the pediatric population. But when patients are obese, that prevalence goes up to about 42%. So we're seeing these things, and a lot of it is because of the change in the lifestyle that our children are experiencing. There was a period of time where you would stay out until the lights came on, and now children are spending more time in front of their computers and on their phones and having a lot of screen time and are a lot less active than they used to be. So there's a real big focus in the pediatric world of kind of decreasing screen time. So the recommendation is that children shouldn't have any more than 2 hours of screen time. And then getting them outside to play, or considering activities that you can do as a family to keep them active, and encouraging physical activity in schools, because that's another place where a lot of activity has been lost as budgets have been cut. PE and gym programs have cut back, and children may not have that all year. They may have it for just a quarter or a semester. And then if they're not exercising in other venues, then we're losing out on an opportunity to keep them healthy and keep their hearts healthy.
And of course, unfortunately, diets are very different than they were back in the day. So can you talk about that as well?
Yeah, absolutely, absolutely. So, when we think about where a lot of children are living nowadays, there are a number of children that are living in food deserts, where access to fresh food and fresh produce is limited. And so what is easily available are fast food restaurants, particularly ones that have the dollar menu. They have affordable meals, but these meals are higher in saturated fat, right? And when we cut back on the vegetables and the fruits and the beans and such, we're cutting back on the fiber that our children are receiving, which are important things when we talk about potential ways to combat high cholesterol, right? And then we talk about more processed foods that we're seeing, and more frozen foods that we're seeing that already have been fried and have been salted. And so we're getting a lot more exposure to that as well, which plays a significant role in the high blood pressure that we're seeing in children as well.
So when you say high blood pressure, do children actually get put on high blood pressure medications?
They do. So we try to work as much as possible to give them lifestyle adjustments to help them lower their blood pressure. But there are a number of children now who are obese and overweight who are having high blood pressure. There certainly are some children that have high blood pressure and it's because of other issues. So there's some children that have high blood pressure because they have a heart abnormality. So for instance, they can have a narrowing of the main blood vessel that sends blood out from their heart to their body. That can cause them to have high blood pressure. And if we do a surgical procedure to fix that, or a cath procedure to fix that, then their blood pressures will go down. We also have children that have kidney problems that have high blood pressure as a result of that, or have thyroid problems that have high blood pressure as a result of that. But again, with the change in lifestyle that we're seeing in our children, we're noticing more and more that they're having high blood pressure, and it's not because of that. It's because they're more sedentary and they're eating foods that are higher in salt and saturated fat and such. So it's a concern.
Yeah, that's mind-boggling. I think that people, as we talk about diet, I work at the American Heart Association. I think people don't realize how bad. I'm from the Midwest, so pop is what it is. How bad pop is for you and those quote-unquote fruit juices.
Yeah, so we're seeing more and more people drinking juice, right? Which contains a lot of sugar, right? So we talk about fructose and sucrose. That while it may not have a direct impact on your cholesterol, we do notice that patients that drink a lot of sugary beverages and have a lot of sweets in their diet are seeing increased levels of high triglycerides. So when we think about fats in the blood, we think about two types. There's the cholesterol, and then there's the triglycerides. And if your triglycerides are super high, like we're talking about numbers in the 500 and above when you're fasting, then we worry a lot about the effect not just on the heart, but also on your pancreas as well. Patients can be at higher risk for developing pancreatitis. So we're very aware of, when we're counseling our patients, particularly those that have high triglycerides, we say, be sure to cut back on your carbohydrates, which sugar is a type of carbohydrate. So we tell them to cut back on the sugary sweets. And then on top of that, what we also notice is that when you're drinking more sugary sweets, you tend to eat less healthy things, right? So instead of grabbing a piece of fruit, you're drinking the juice form of it, but you're missing the fiber, right? So the nutrient density of your foods then decreases because you're filling up with just juice and sugar, right? That has little nutritional value. And patients are spending are when you're having that as well, you're increasing the calories that you're getting. They're getting full off of something that's really not providing their body with a lot of nutrients. So we're very mindful in our patients that have high triglycerides to really speak to cutting back on their sugar in their diet, and particularly sugary sweets. I have seen some patients, as we talk about obesity, lose weight just from cutting out the sugary drinks in their diet and focusing more on water for their hydration. So that's one of the things that we promote heavily in our clinic.
So I have a question. A lot of kids do sports, and when like my sister, perfect example, she did basketball, volleyball, and golf, but specifically volleyball and basketball, she drank a lot of Gatorade. Now, is that stuff actually good for you?
So, Gatorade and Powerade are sports drinks, right? Were really developed for patients that are not patients, for athletes that are competing at a very high level. And it was really made because they're sweating in these high intensity workouts that they're doing. And in turn, they're losing both water and salt. So the goal is to keep them from becoming dizzy and passing out in the field, is to replace some of the salt and the fluids that they're losing in that manner. The reality is that most of our children are not working out at that same level, right? And they're getting lots of salt from other places. So Gatorade and Powerade is not something that I routinely recommend people drink from day to day as, a substitute for water. There's nothing really that replaces water. But there are some patients who I do sometimes recommend Gatorade and Powerade for, and those are patients that have low blood pressure, they're passing out a lot, things like that, and I'm trying to help boost their blood pressure. But for the average person, no, there's not a need for Gatorade, Powerade, liquid IVs, body armors. I don't want to leave anyone out. I'm not trying to promote any one or say one is better than the other, but there's not a need for those high salt drinks because you get enough of what you need through your regular diet.
Thank you, because I just, parents, they do the best they can, and if you don't know better, you can't do better. So here's
Absolutely. And it's salt, right? It's salt. So if you're having, if high blood pressure is your issue, well, you just drank, about a good 1,600 milligrams of salt, by drinking a couple of Gatorades. And ideally, we want your salt intake to be, when you have high blood pressure, to be 2,000 milligrams or less. And you might have just drank it all, depending on how big of a sports drink you consumed. So it's really important to be mindful of that, particularly if your pediatrician or your cardiologist says to you, hey, your blood pressure is elevated, and you may make all of the changes in what you're eating, but also think about what you're drinking as well. Another, if you don't mind, another thing that we talk a lot about in pediatrics are the noodles. So, and when we think about the ramen noodles and things that exist in the market. So the noodles themselves are carbs, and if you're trying to cut back on calories and such, it may not be that may be an area where you can cut back. But then when you look at the sodium content of a packet of noodles, a lot of times we're talking about 1,200 to 1,600 milligrams of salt just in the packets that you put in to season the noodles. So I frequently ask my patients, because it's a quick, easy meal that you can make after school, are you eating oodles of noodles or ramen noodles or whatever noodle brand? And if so, have you ever looked at the back and asked yourself how much salt I'm getting? Because they can also fool you by only putting what's in one serving. But when you realize that a packet may actually be 2 servings, then you realize that you've pretty much gotten your day's worth of salt just in that. So for children, I ask a lot about Gatorade, Powerade, sports drinks, and I ask about noodles as well, and being mindful of the amount of sodium they're taking in that way.
That is something that I wouldn't have thought about, but I guess especially with a lot of working parents, that might be an easy go-to thing that they could pop in the microwave and eat. And so that could be problematic as well. Also, I think, like I said, working with the American Heart Association, another thing they always pointed out was that one donut contained like more sugar than you could possibly imagine. And so we need to not, necessarily think that a donut is a good thing to pick up on the way to school. Nice treat after school.
Exactly. We should think a lot more about having wholesome meals for school, right? Before you go to school. So as opposed to picking up something sugary and quick, thinking about things that have a little bit more protein that will last longer and provide you with more energy throughout the day, as opposed to the short pick-me-ups that you'll get from a donut or some other sugary something that you may eat for breakfast. It'll give you a quick boost and a quick fill up in the morning, but you'll quickly burn that off, and you'll be hungry again, and then you may eat more of the same. And so as we talk about being mindful of the calories that you take in, we want to focus on foods that will last longer for you, that are high in fiber, high in protein, and will provide you with long-lasting energy throughout the day.
So I wonder, do you have a lot of patients that are diabetics? Type 2 specifically?
So I do have patients that have type 2 diabetes more and more. Again, as we're seeing the obesity epidemic increase, we're seeing more children that have type 2 diabetes. Now, while I personally am not managing their type 2 diabetes, we're working closely with their endocrinologists and with their pediatricians to make sure that we are appropriately managing their type 2 diabetes, because having that certainly puts you at higher risk for having high cholesterol as well. And so for patients that are diabetic in particular, because I know that alone is a risk factor for early heart attacks and strokes when they get into adulthood, I spend a lot of time focusing on making sure that they manage, that they're paying attention to their endocrinologist and doing what they say and managing their sugars appropriately. But also making them aware that, just by not controlling your blood sugars, you can be at higher risk for having high cholesterol levels as well. And, that combined with diabetes will put you at higher risk for having an early heart attack or a stroke. And for us, we consider an early heart attack or a stroke in a male any that occurs before 55 years of age. And for females, that's any that occurs before 65 years of age. And so our job really, we see it as pediatric cardiologists in the preventive space to think about all of the things that start off in childhood, because we know these processes start in childhood, and giving parents advice on how to try to avoid that, because we really want to have children that are living longer, they're prospering, and they're contributing to society and living healthful and fruitful lives. So if we know that the habits start in childhood, if we can get them to have good habits now, that they're more likely to have great habits as adults as well.
So I know that for adults, we say that you need to have, 150 minutes of cardio exercise a week. So what do you say to the children?
So I tell them, really, we want them to have an hour per day of exercise, right? But I also recognize that we have to be realistic about what is achievable, right? And for some people, it's not achievable to go out and play for an hour every day. So let's start with something feasible. I think the adult cardiologist would agree with this, that we start off with small goals. So I start with small goals practice. If you're a child that doesn't, go out every day, well, let's just talk about twice a week for 30 minutes. Let's get you started with doing something. And if we can do it as a family, then that makes it even more achievable, because it's one thing if you have to go do it by yourself, but it's another thing if everybody's coming with you and we decide that we're all going to go for a walk for 30 minutes. And then I have them gradually build up the number of days that they're exercising, and the amount of time that they're exercising, so that we get closer and closer to that goal of an hour of exercise each day. And even if we can't meet that goal completely, just doing a couple of hours or a couple of minutes several times per week is better than none. So we really just want to get you up and moving, so that you can burn some of the calories that you take in. And then we have them work with our nutritionist to kind of think about the calories, how to read labels, because that's a very important thing, to know how to read labels, so you can have a sense of what you're getting and what you're putting into your body each day. So, yeah.
That is interesting. An hour a day. Wow. And so it's really unfortunate that a lot of school districts have gotten rid of PE gym class, like you mentioned, because there is, I think, a 30-minute slot that was at school that they could get, and then they do another 30 after school and they're done. So,
Exactly.
yes.
Exactly. It is unfortunate, but I understand budgets and stuff like that, and so I encourage parents to try to figure out what resources exist in their community, such that they may be able to get their children involved in more things. So, like, does the YMCA, right? The YMCA tends to have a sliding scale for how they give your membership, or how you pay for your membership, right? Depending on your income. So maybe that you may be able to get a reduced rate membership to the YMCA. There are a lot of larger gyms that during the summertime, they're offering discounted rates for teenagers to come in if they've been cleared by their pediatrician to exercise, and they can come and exercise at their gym for a reduced rate. So those are opportunities that we can take advantage of to try to get our kids more active if it's not feasible within our own home.
Well, I didn't know about the sliding scale with the YMCA, so that is great. But please do not let that be a barrier to you. Your children could walk around the house, for Pete's sake. But
Absolutely, absolutely. Walk around the house, walk up the stairs. Walk around your backyard. Sometimes it's not as scenic. It's sometimes it's easier to work out when you're with others, right? So that's why I always encourage people to do it with their families, because that makes it easier than just saying go out. But you can jump rope. You can throw the basketball by yourself. You do not have to certainly invest in any gym membership in order to do this. There are simple things that you can do at home. And I've had some kiddos just say, I'm just going to walk the stairs for 10 minutes. And that was a start. And we took it and we started to see progress. And then they've added on more, and we're seeing more and more progress. So it's amazing. And it's something special to see children's eyes light up when they're making this progress, right? Like when I show them their chart and it says, oh, look, your BMI is coming down. Look at your cholesterol levels. They've gotten so much better. What have you been doing? I'm so happy for you. And it's really wonderful to see their faces light up and their desire to do better and more. And we come up with goals together that they can achieve for our next visit, and that gives them some positive feedback to help them motivate and keep going. So I think receiving it in our office, receiving it from their parents, receiving it from the schools, their teachers, all of these different places. I think we all have a role that we can play in encouraging our children to get active, and ultimately to combat obesity, which the paper just came out that talked about how obesity really is the starting point for a lot of things that go on in adulthood in terms of putting you at risk for heart attacks and strokes, right? So, and that's especially important for our community, as you mentioned.
So I wanted to go back to cholesterol. Could you explain the importance, the correlation specifically with cholesterol in hearts? Because I just don't know that everyone knows how important our cholesterol levels are.
Yeah, so cholesterol is a type of fat in your blood, And over time, it can deposit in the walls of your arteries. And it can deposit in the walls of any of your arteries, in the arteries that, go to your arms, your legs, your neck, right? But we also we're really concerned about the small coronary arteries that they can coat the lining of. And if they coat the lining of the coronary arteries and the wall, the buildup, if they also have, if it builds up to a point, excuse me, let me start there. If it builds up to a point, and then it collects platelets and other things in that area. If that area gets interrupted for any reason, then you run the risk of ultimately building up something that can then block your coronary artery. And the coronary arteries are important because they feed your heart muscle. So just like every muscle in your body, your heart muscle requires oxygen. And so if you can't get red blood cells through your coronary arteries, then you can't get oxygen to your heart. And that's when you develop angina and heart attacks and strokes, right? Well, strokes when you can't get blood flow to your brain. But in particular, heart attacks, that's how you can develop a heart attack from having high cholesterol. And it's really from like long-term exposure to high cholesterol. And what we know from a pediatric standpoint is that when we've done autopsy studies on children who have passed away for other reasons, so we say like in a car accident or something like that, and we do an autopsy and look at their coronary arteries, we're already seeing that process start in childhood. So it's really important that we start thinking about developing healthy habits in children, because again, if that process is starting now and then you're talking about long-term exposure to high cholesterol, high blood pressure, high blood sugar for 30, 40 years, well, certainly you're at higher risk then for clogging up that coronary artery, if you will, and having an early heart attack. So that's why we focus on it. It's one of several factors that we focus on in terms of reducing your risk for early heart attacks and strokes.
So yesterday I was actually on News Nation and we talked about milk in adults and children. But, excuse me, in children specifically, I talked about how the two most important and basically the only things they need to drink are water and milk. Now, can you please explain to people the 5-year-olds still need to drink whole milk and why?
Well, one, whole milk has a lot of saturated fat. So when you are much younger, right, and really, I will go so far as to say when you're first born, all you need really for the first year of life is breast milk. And you could probably go beyond that. Breast milk is milk that's formed by humans. It's made for humans, and it contains all the nutrients that babies need. So we'll start there. So for at least the first year of life, if you are able to breastfeed, then I say, please breastfeed, right? Because there's a lot of good nutrients. There's immunoglobulins, right, to help you fight off infection that's in breast milk that you are passing on to your baby. So starting there, really, breast milk is all they need. Beyond a year of age, if you decide that you want to stop breastfeeding, well, then whole milk is okay for a period of time, only because it contains a lot of the fats and stuff. So as kids are, going through hormonal changes and growing and such, that they need some of that fat. But then but when you give them milk beyond that point, really, you don't need anything more than 2% milk, right? Because that really is the minimal amount of fat that you need to take in. So really, when we're talking about high cholesterol, high blood pressure, or high cholesterol in particular, we're really focused on cutting back on your saturated fat. And so whole milk contains a lot of saturated fat, and you really don't need any. Skim milk is really the best. But I know that a lot of people feel that once you start getting below 2% milk, it doesn't have the same taste anymore. So if I can at least get you to 2%, I feel like we're making progress there.
My sister said it was see-through. So the milk is see-through. I don't know how you drink that, because I grew up, I was allergic to dairy milk. So I had soy milk, and then I got off soy milk because we figured out it was part of the nut family, and that's why I was losing every day because I'm losing nuts. So at 10 years old, cut soy milk. So when I went to college, my mom was like, I think that you're probably okay to have skim milk. And she was right. My mother's a respiratory therapist, and so she tested things out, and clearly I'm okay. And so I started drinking skim milk. My sister was like, I don't know how you drink it. It is blue. It's so secret.
So, I love milk with ice. So, and I always like my whole milk with ice. So 2% milk tastes like milk with ice to me. but I understand if you drink whole milk all of your life, then you might not like the taste of skim milk. That might be a little bit far for you. But if we can at least get you down to 2%, then we're making some progress. That's a lot of extra fat that's just not needed, and a lot of extra calories that's just not needed.
See, we are giving you a lot of hard health information, but we're helping you in the scale too. Watch. Some of these things, like she said, I know people that have gone with pop without their diet in 1 year and have dropped, at least 30 pounds in a year, solely because they dropped pop out. That's it.
It's just, you're just drinking sugar. That's it. And it's not providing you with anything that's really helping your body function from day to day. It's simple sugar. It's not even complex sugar. So, if you're going to waste calories, or if you're going to, take in calories, take in something that's healthy, that's going to help you fight high blood pressure, that's going to help you fight your cholesterol, taking in whole grains and fiber and things like that, that's going to actually be helpful to you. If you only have so much that you can spend. It's like if you have money, right? If you only have so much that you can spend, right? Then you're going to be mindful of what you're buying from day to day. So you should think of calories in a similar way. Like if you only have so many calories to take in each day, well, maybe you don't want to waste it. Maybe just a 3-ounce glass of juice, if you're trying to wean yourself off, or an 8-ounce at least glass of juice. But do you really need like 2 solo cup sizes of juice? Probably not. There's nothing good there, and it's just filling your stomach up, and then you've missed the opportunity to have something healthy that would give you just as many calories, if not more. And you might even be able to eat more food, right? That's more nutrient dense, right? So we're mindful of portion sizes, but certainly, fruits, vegetables, things like that, you can eat more of those things, and still stay healthy, right? So as opposed to eating a lot of junk food that's just going to pack on more pounds for you.
Sorry, guys, we're having an audio issue. So I was a huge drinker of juice in college, but my juice was 3 parts water to 1 part juice. So we would get bottles of juice from Sam's Club, and the bottles would go a long way because I would pour them into something else and shake it up, and there was more water than it was juice. But that's the way I drank it, and that's what made it better because it wasn't the sugar, because I watered it down. And even if I went to a restaurant and asked for juice, I did the same thing. I watered it down there too. So that is one thing that I picked it up on. There was a lady who babysat for him. That's what she did with her children, and I drank it. I was like, this tastes better than juice tastes regularly. I realized it was too sweet for me, and so I started doing that. And I think that's a great thing that you guys can do.
Yeah, I think, if you, particularly if you are a person that grew up drinking a lot of juice, and, we talk about taking baby steps in order to wean you off and get you to drink more water. I think that's certainly a good way to do that, right? You can put a little bit in, but make it more and more water each time until you eventually get to the point where you're drinking water. But, I'll also tell my kids, I don't have any problem with you putting a little fruit in your water, right? And letting it sit overnight, because certainly that gives it some flavor, because some people like flavor. It's really the flavoring, right? So if you put some fruit in it, you're not putting extra sugar in it, right? But you're still getting the sense of, I taste a little bit of lemon, or a little bit of, cherry, or a little bit of lime. You may be more likely to drink it. And I'll tell some even I'm okay with you putting a little drop of Mios, like 0 calorie, like something in it just to give it some flavor, because I understand that. And some kids even say that they like the sparkling waters, and I'm like, that's fine. If I'm getting you to drink water, then I'm happy about that.
This has been some amazing information that I know that our audience definitely needed. What are some takeaways that you would want us to know when we're worrying about our kiddos and their hearts?
So I think at the end of the day, what I really want you to take away is that the things that we develop in adulthood frequently start in childhood. And so it's important that we develop healthy habits in our children now so that they'll live longer, productive lives, and that they're less likely to have early heart attacks and strokes. Again, an early heart attack for a male is any that occurs before 55 years of age, and an early heart attack or stroke for a female is any that occurs before 65 years of age. And knowing in particular that, our community is at higher risk even, and Black women in particular are at very high risk for early heart attacks and strokes. It's very important that we start early with encouraging our kids to, eat healthy, be mindful of the salt that they're putting in their foods, to choose healthier snacks like fruits and vegetables, to eat their beans and such that are providing them with fiber, and then to keep them active and getting them to participate in some form of physical activity, ideally 7 days a week, but at least starting off with 2 or 3 times a week, getting them to participate in some activity, because that's a habit that if they start in childhood, they'll keep in their adult years. So I really want everyone to be aware of that. I tell everyone all the time, I want you to put me out of a job, right? So I'm a preventive cardiologist in the pediatric realm, and I tell them, I want you to put me out of a job. I want it to be such that I only take care of patients that have genetic problems, right? So there's some people that there's no matter what they do, they're going to have high cholesterol because they have a genetic problem where their liver isn't processing cholesterol properly. And those are the patients that I feel like I should be seeing and making sure that we're putting them on medication to try to get their levels down, because no matter how healthy they eat, they're still going to be at high risk. But there's a population of patients who, if we are able to change the way they eat and the way that they exercise and stay active, that I shouldn't have to see them in the future. They should put me out of a job from that standpoint. So I encourage all parents to think about that. And if you ever are you're kind of wondering, well, what should I do? Take advantage. Your pediatrician is a wealth of knowledge in this area as well. I mean, this is the bread and butter of what we do, is talking about, okay, these are the developmental things. This is what your child should be able to eat and drink at this age. This is what's healthy. This is what's not. And so your pediatrician's has a wealth of knowledge. And, if need be, your pediatric cardiologist is a wealth of knowledge as well. But the goal is that you don't have to come see me, and that only people that have genetic problems do. But if you do, let's work together to try to figure out how we can get your child back into a place where we're less likely to need medication in order to manage their situation.
Thank you so much. Can you please tell everyone how to reach out to you in case they have questions after this?
Yes. So you can hit me on Twitter at I am Dr. Mickey. I also work for Children's Healthcare of Atlanta, so you can also track me down through Children's Healthcare of Atlanta through their website as well.
Thank you so much. And I know I promised an adult cardiologist to all you guys, but like I said, she got stuck seeing a patient. So we'll definitely have her on at a later date. But I definitely want to thank Dr. Michelle Wallace for carrying this thing for 45 minutes, because, usually not one person, we don't go that long. So you did fabulous. And it was wonderful, amazing information. I hope everyone is sharing this. If you're watching the replay, I know that you know a child that has a heart that you need to share this with their parents so that they can make sure that their children do not end up with early heart attacks. Unfortunately, I personally know in the last 5 years, 2 or 3 people that were less than 35 that died of either strokes or heart attacks. So we don't want that, because they left children, wives, husbands, families, brothers, sisters, parents, and we don't want that. So
this advice is good for everyone, no matter your age. So adults can cut back on juice, they can cut back on noodles, they can watch what their portion sizes are, they can do all of this as well. It is not just a childhood thing.
Definitely, and that's why I like that you tell the children, and the children get so excited because the children can encourage the parents. And if you have to feed your child a certain way, guess what? I bet you'll be eating the same way too, because you don't want to make 10 meals. So it's all about, let's work with our. If you're not going to live for yourself, live for the children. So that's why we should take care of ourselves, because we don't want to leave them. So please, everyone, I always tell everyone, live like you deserve, but we only have one life. This is it. This is not a dress rehearsal. So we gotta do it, and we gotta do it right now. You hear her say that if you can get these things tackled as a young child, then when you become an adult, you don't have to worry about hypertension medication, high cholesterol medication, and all these different things. A lot of people say it's too expensive to eat healthy. But do you know how expensive it is to take care of somebody who's sick? Do you know how much medications cost? Hospitalizations, to go to all these specialists, the gas, the time. Trust and believe, it is a whole lot cheaper to avoid the dollar menu and prepare a meal, or to find a meal service that you can afford. It's so much cheaper. So just be mindful, and we will see you again next week. Thank you so much, everyone. And actually, Tuesday, you guys, is the State of Black Health for 2024, and we're going to have 5 hours of intense conversations about weight, about mental health, about caregiving, and about chronic disease. So you don't want to miss it. And thank you again, Dr. Michelle Wallace.
Thank you, Dr. Renee.